Okay. Good evening, everyone. Thank you for joining me this evening for this information session. My name is Dr. Toby. I'm presenting to you here from Central Victoria. And this shouldn't take more than an hour to go through what Jericho is about. So I'll just start by sharing my screen. Um, so let me know if you can see the presentation. Can you see that? Okay, good. Just hold on a second. Okay. So I'll go through an outline that I've listed here. Just you know, some information about myself, what the issues are, what Jericho is trying to solve, and I'll go through a demo on their platform and answer any questions that you may have. You can type in your questions as we go along in the chat box or wait till the end. So my name is Dr. Tobi Kupolui. I moved to Australia with my family in 2013, initially in Newcastle. And then we moved to Victoria about 5 years ago. I finished my training as a GP in 2022 and got to know about Gerocare in 2023 when I was looking for that type of service for my and then a few months ago the management team reached out to me to ask if I would be their spokesperson really in Australia to market the service to Nigerians here in Australia. So I just say that to say that you can always verify the information about me online. um so the issues that that are currently going on in Nigeria is that we all know that the health system is not very good, and obviously the elderly are even more prone to those issues. So we can see from the data there that the life expectancy is 63 years by according to WHO, and out of that, by age 55, most people will have one or two health conditions if they check. So obviously it means that, if you have elderly people above that age range, you can guess that they have one or two health issues that you may not be aware of. The other issue there is the distance. Obviously, people migrate every time, and not just out of the country, but interstate from rural to the city, and oftentimes we're not together with our parents or our elderly loved ones. So, we don't really know exactly how they're faring, or we just go by what they tell us, which may not be true most times. And the big one is immigration. People are leaving the country, middle age, working class people are leaving the country, and it just creates that gap where we have elderly loved ones in Nigeria, and we don't really know what their health status is, or we just rely on what they tell us. Um, so how do we sort of solve this or try to solve these issues? Oh, before I go on to that, just another data to say that before the age of 40 years, about 75 people would have lost one or both parents, due to untimely death from one or two health issues, and it just corroborates the WHO data in the previous slide. So if you are about that age and you have both of your parents alive, first of all, that's a blessing. But the likelihood is that they have some health issues already. So in terms of trying to solve those issues, these are some of the things that people can do, and we have done as a family as well. So you can rely on the parents looking after themselves. Again, that may not be reliable, or sometimes there's no symptoms of anything and you don't know until it's last minute. You can rely on your family and friends if they're still in Nigeria, or if they're still where your parents are. Again, they also have their own responsibilities, and it may be difficult for them to combine all of theirs and trying to look after your parents as well. Private hospitals are an option, but there's always a card fee to that. The cost might be prohibitive depending on the kind of private hospital. And you as the child or relative, you don't really have access to the medical records or the information about what's going on. Public hospitals are an option, but which it might be cheaper, but you have to deal with the waiting time. It's a crowded place. And again, you don't really have access to the doctor that they saw or the health professional that they saw. So, you're left in the dark as to what's going on with your elderly ones. People also, use medical tourism, but again, that's very expensive. You have to deal with the visa and the traveling, and it's time consuming. And how often can you do that on a regular basis? So Gerocare fills those gaps, and I'll just go through what Gerocare is all about. So essentially, it makes it possible for Nigerians at home and abroad to subscribe to regular doctor home visits and Medicare care for their parents and elderly loved ones. So I guess the emphasis here is that it's not only for diasporans. You can, and the service can be applicable to Nigerians in Nigeria, but in a different place, different part of the country, or they don't have the time to do all the work in terms of healthcare for their elderly ones, and definitely applies to those of us outside the country as well. And they do this through an established network of doctors and partners across the country. So they've been in existence since 2017. Like I said, I only got to know about them in 2023. And they have partnership with corporates, with NGOs, with HMOs, with pharmacies, with labs, with obviously with doctors as well across the country. And that's how much they've done in terms of home visits over the years. And apart from Australia, obviously they're also reaching out to Nigerian population in Canada and US and Canada and UK as well. Again, there's an increase in the number of diasporans, so there'll be a lot of Nigerians that will be potential beneficiaries of this. So how does it work? So basically, you go to their website, gerocare.org, you sign up as a sponsor, and then you add a beneficiary. So just to clarify here that, it could be your parents, it could be your in-laws, your grandparents, your uncle, really any elderly person that you want to look after can be a beneficiary. And then what happens is that the client services team make contact with you based on your own phone number or your phone number you're put on. And then they introduce themselves to you and sort of answer any questions you may have. And then you make payments for the subscription service that you want. There are many payment options: Stripe, PayPal, or Flutterwave, with any international payment card. And then what happens is that they match the beneficiary with a doctor, depending on the address. And after you paid, they schedule the first visit within 72 hours. That's a regular visit. If you want something sooner, that can be done as well. When all of that is done, you as the sponsor, you get a report of the visit on the platform, and you can access that quite easily. They also contact the beneficiary, obviously, to let them know that this is happening, and the doctor liaises with your beneficiary to let them know when the best time to come and visit. So in the doctor visits, what happens is that when the doctor arrives, they checks in. And I remember the first time I did this, I got an email when the doctor checked in and when the doctor checked out. So I was able to tell exactly how long the doctor was in the house for. And like I said, you as a sponsor, you receive the report of the consultation. There's actually a time limit to that, beyond which the doctor gets penalized. So essentially it means that you're not waiting 2-3 days to get a report. It's only within a few hours you get a report of what has happened. And there will be recommendations in the report as to whether the doctor thinks that they need to have blood tests or any investigations done. What happens is that the client services team then costs those extra services, and then they invoice you. So you go through it. If you're happy with it, you pay the invoice, and then they organize for those things to be done. So if it's medical tests, if it's just blood tests, they can just send the phlebotomist to come and take the sample. If it's a scan, they will organize for pick up and drop off for your other one. So essentially, it's a hands-off approach. As long as you pay the invoice, the service gets done. You don't have to really be there to do it. The same thing for prescribed medications. They can drop off that as well after the invoice is paid for the medications. So what are the benefits to you as a sponsor? Well, the first thing is, there's peace of mind. You don't have to worry about the health condition of your elderly one. As long as you continue with the subscription and you follow the recommendations, you get reports of what's going on. And you don't have to rely on a third party, or we all know that our parents don't really tell us the truth of what's going on. So, you don't have to rely on all of that. You get the first-hand information from a medical service. And yeah, I've covered that as well. So real-time updates on your parents' health status. And then you have access to the medical reports. And I didn't think of this prior, but interestingly, after we subscribed to the service, my parents had to apply for immigrant visa in Canada, and that service will require the medical records. So it was easy for me to just go on the platform, download the document, and send it across. So, you couldn't get that with the other options that I went through before. Now there's a lot of value in the service, and I would say from my point of view, it's affordable. If you see what the value they're bringing is, it's quite affordable to engage them to do this service. Now, what are the benefits to the elderly? Obviously, it's access to medical care in the comfort of their home. And I'm sure you agree with me that most people they'll prefer to be in their home space as opposed to be in a hospital environment. So that takes off the issue of transport or standing in queues and all of that. So it's essentially like a VIP treatment for them because the health services is really coming to their home to provide the care for them. And then what the subscription also gets you and the elderly is access to the doctor. So on the platform, you can see their phone number. Generally, we're encouraged to contact the medical services. So the Gerocare has a medical services team that you can reach out to, or they can reach out to, and then they can, sort out whatever the needs are, whatever questions that they may have, or they can reach out to the doctor directly. And from the elderly's point of view, it takes away the concern of trying to think about, do I buy these medications, or do I buy food, or do I pay for other things? So, that takes off that there's one less thing for them to worry about. And obviously it's a means of prevention and early detection of health conditions. Like I said, most times it's more that we haven't checked as opposed to they are well, and if we don't check, we don't know. Okay. Now this is important from an elderly's point of view, I would say, because there's the social interaction that they get from the visits. Sometimes, depending on the location, that might be the highlights of their month. Having someone to come and check them, do their blood pressure and things like that. And that can be good for their health as well, even if there's nothing physical wrong with them per se. And definitely, there's the reassurance that though their children are not with them, wherever they are thinking about them, they're thinking about their health. So, it's very important to our elderly ones to know that they are being looked after. The other services that Gerocare covers besides medical is nursing. So we use their services for this. So we have a live-in carer for my parents. And the living carer can be an assistant in nursing or auxiliary nurse, or can be a registered nurse, depending on what the needs are. So what happens is that they do an initial assessment from a nursing point of view, and then make a recommendation of what kind of nursing care that's required. So, someone that had a stroke, someone that just had a major surgery, all of that can have nursing care at home, depending on the need. Like I said, they do home diagnostics and pharmaceutical services as well, and other allied health services. So if you need a physiotherapist or occupational therapist, or all those kind of other things that are not strictly medical, but health related, that the elderly people require. So they can organize all of that for your elderly ones. So in terms of the cost, so I'll just start with the regular visits. So the regular visits stroke subscription services, the regular one, in which case that's the when you do the first time, they get seen within 72 hours, and subsequently, depending on how many you pay for, the further appointments will be booked. If it's a matter of on-demand service, say something's happening now and you want them to be reviewed as soon as possible within 24 hours, that's $50. And we've done both of those on different occasions. And well, my parents are in Lagos. I don't know if that had anything to do with it, but it was within 24 hours really that the visit was done for $50, and that currency there is US dollars. There's also teleconsultation, so phone or video a consultation for those for $5 to $7. I've never used this one, but again, I don't feel that that brings as much value as being seen in person from an elderly person's point of view. But that's there, if anyone needs it. And like I said, the caregiver services, obviously that will be case specific depending on what the needs are, but the range can be from a non-medical caregiver to a registered nurse, and personal cares as well. So all of that can be done at home. So this is just to say that, like I said, Gerocare has been in existence since 2017, and in that time, they've had a lot of awards, both national and international. So they're recognized for, for the service and the work that they do. And this is the management team. So Dr. A.B. Offrey and Dr. Ajibola and Bruce Lucas. So Dr. A.B. is a medical doctor, and his profile is listed there. Dr. Ajibola is an academic doctor, has experience in the National Health Insurance Scheme space, and you can see their profile there as well. So I will just play a short BBC feature video about Gerocare, and I hope you can hear it.
Gerocare is actually leveraging technology to fill in the gap or to help with the failing health system in the country, especially as regards to the elderly. Though we know in Nigeria the health system is not as it should be, but it's even worse for the elderly, because even the system that exists, as inadequate as it is, it still doesn't consider the elderly in any way. So we are trying to leverage technology to provide care for these people and make it possible for them to receive a semblance of decent healthcare. The care we provide is primary healthcare, and so GPs and medical officers are able to provide this type of care, and then they are overseen by consultants to review what they do. Once they come on board, they input their details, their medical certificates, their MDCN number. Fortunately, in Nigeria, medical service is one of the well-regulated industries whereby you can identify every single doctor. So we also have an extra layer of client services who ensures the patients are happy with their doctors.
Yes. So mom, you're doing very well. Blood sugar is fine. Blood pressure is fine. I'm impressed.
Our subscription is based on the fact that our visits to the elderly are not one-off. When you pay your subscription, you have access to at least one doctor visit. That doctor assigned to you is at your beck and call for the month. You have access to the platform and the reports and all those things. So for instance, you can take your mobile device and then look how mama has been for this period of time by checking their reports. So nothing really surprises you. We want to avoid the situation where you get to the house and the only solution is to take them to the hospital because you've not seen them for a while. But if you see them regularly, you catch those conditions at the earliest possible stage and manage it such that it never becomes an emergency. So though it helps their health, what it tells the parents is that though I'm in Lagos, you're in Port Harcourt, or I'm in the UK and you're in Nigeria, I still think about you. I need to ensure you're doing well. So the future for Gerocare is ensuring we're able to actually make medical home care services the first line of care across board.
Okay.
Gerocare.
Sorry, I think that was it. Okay. Does anyone have any questions at this stage? I will go through the website and a few important bits that I think we should know about. But does anyone have any questions at this point?
Okay, I do have a question. Okay, I think I have two.
Yes.
So the first one is concerning patient confidentiality.
Yes.
Do the parents sign something to say that, or the beneficiaries rather, sign something to say that we want our child or whoever is paying for this service to have all this information? Or
yeah. So not to my knowledge.
Okay.
And I can speak from my own experience. I don't think that conversation was had. So that's the short answer to your question. But I get what you're saying.
Yeah.
On the other hand, though, if you think about it as an African, yeah, this is your child trying to help you, kind of thing. I think there's the unspoken acceptance of that confidentiality because they know that someone is coming to see them because you've paid for the service. And they've accepted that they're available for the doctor to come and see them. While there's no routine thing or explicit conversation in that regard, I think that sort of goes without saying. That's just my thoughts.
Yeah.
Yeah, that's sort of how I can
Okay.
answer that.
Another side to that. Okay.
Yeah. I was gonna
Another
say
side to that is okay. Just go on, please.
Yeah. I can talk to the CEO about that and see what he thinks
Oh
about
no,
it.
it's just a question.
Yeah, I understand. I think it can be important, but
yeah.
I just feel that the relationship here is parents or elderly one and a child. So I don't know. I feel that might not be too necessary, but I can talk to him about that.
Okay. So another side to that is, what if this is just a scenario, like what if there's sometimes our parents wouldn't really want to bother us with what is going on with them health wise. So is there something where the is it possible? I don't know, because the doctor is sending the report directly to the person who has paid, right? Can the parent tell the doctor, please don't add this information, I don't want my child to know this?
I'm not sure. I can't say that for sure. So what you have, in terms of access to the medical record, so it gets uploaded on the platform, and you as a sponsor or they as the beneficiary can access it. You just have to share it
Okay.
with them.
Mm.
But in terms of redacting any particular part of
Mm.
the consultation, I'm not sure what the provision is for that, if there's any.
Okay.
Okay.
Thank you.
Hello.
I have one more question.
Yes.
Or okay, Toyin, you can go. I think Toyin is saying something.
All right. Thank you very much for the presentation. It's very, very informative. Yeah, I'm actually of this the opinion. The second question that she asked, can the parents or the person you sponsor in Nigeria protect their how let me put it this way, how would they be able to protect their confidentiality? It is true, it's their health. If they don't want to disclose it, how is that going to happen? For example, the papa has a diabetic or prostrate, or whatever it is. And you know our typical people, they don't like you to know.
Yes.
One thing, maybe they don't want you to panic or something like that. How could that happen? Because the report is sent to me or sent to, and they can have the report as well. So
Yes.
would they be able to raise their hands up and say, no, I don't want to share this?
Okay. Again, I don't know if there's any provision for that. I have not had any. Well, my parents haven't said that they don't want any of that to be shared with me. So I don't know. It may be different because I'm a doctor. So, how much can they really hide from me? But, I don't know what the answer is. Again, I will take that back to the management and ask, what the provision is in the system.
It's not common, but it is possible.
Yes, I
It's not
understand.
common. I don't have parents, but probably my sisters, aunties, or something like that.
Yeah.
That
Oh,
I want
yeah.
them to feel free that I'm not just going to put nothing into their affairs, but
Yes.
I'm ready to sponsor them if there's any problem.
Okay, I understand what you're saying. So that's a bit different to just directly with parents, if extended family. So I would ask, and I would get back to I'll get back to you. So I have your email addresses. So I'll just
Yeah.
send the answer whenever I get it to.
So we cannot sponsor our extended family. Is that what you're
No,
saying?
no, no, you can, but what I'm saying is that the issue of confidentiality and trying to that issue of privacy and all that, I guess will be
Yeah.
much more of an issue with extended family as opposed to your parents.
Mm,
So that's why I said that. So I will ask the team and get back to you as to what the answer is.
Okay. Thank you.
Um,
And now, sorry, another question I want to check, or maybe I missed because I went downstairs to do some other things. Like, so there is reports the care is actually inside Nigeria by
correct,
a
yes.
reputable clinic
No.
or
So
centers.
no. It's not a clinic that is providing the service, it's individual doctors.
Right.
So what happens is that, so just thinking about it as like a Uber service. So the doctor have their own platforms. So where
Mm-hmm.
they are onboarded. So
Yeah.
they've been verified as being doctors. They get onboarded, and depending on what their location is in Nigeria, they are on the Gerocare network. Okay, so when there's a beneficiary registered in their area and they can service that person, they put their hand up and then they go and see the person. So it's
Okay.
it's with individual doctors, not a clinic as such.
Okay. So they have doctors in different locations in Nigeria.
Yes, I will take you through the coverage on
Mm-hmm.
the, but they do have coverage all over the country.
Say you have your family in Ifo or
It
Ota,
doesn't it doesn't
something like
matter. I would check. I would show you on the website, but it doesn't matter.
Okay, my next question is so can the beneficiary use their own service provider for like the lab and radiology and then send
Yes.
the results to the doctor,
Um,
or it has
yes
to
and
be the
no.
one? Okay.
So yes and no, I'll answer that. So because I did ask this question myself. So what happens is that when the doctor visit is done and recommendations are done, yeah, and you want to do the test yourself, you can. So if you organize that yourself, the results will not get put on the platform,
I see.
and the doctor cannot review the results.
Okay.
Okay. So, and it sort of defeats the purpose, isn't it? If
Yeah,
you're still,
true.
yeah. So, but if it's hands off, and then yeah, you pay for logistics, obviously. The results get put on the platform. The doctor reviews the results and puts a note as to, what the next steps are, what the explanation of the results are. And everything is in that on the platform. One other thing I checked at the time when I wanted to engage the services, I actually contacted the lab myself to see what their pricing was. And the pricing, if I did it myself, was more expensive than if Gerocare did it.
Okay.
And the reason is that Gerocare as an organization, obviously, they have corporate discounts with the labs. That's part of the deal. Okay, so it means that they're not guaranteeing, but they're saying to the lab that there's a lot of volume from their point of view, and based on that volume, they get the test done for less. And I checked it with different labs at the time. I think I checked 3 labs that they use to get the pricing of that lab, and it was more expensive than if Gerocare did it.
Oh, okay. Last question. So the $30 a month is for the doctor to come every month.
Yes, if that was your choice, yes.
Yeah. So if is there a service where I feel depending on the participants or beneficiaries' health issue,
Yes.
they might not need a doctor every month. Maybe once
That's
a
correct.
year.
Yes.
Is it the same $30 or?
Yes, $30 for the visit. Yes.
A
So
visit, or because I know the $50 was for the emergency visit. So if I'm going to be on a subscription basis,
yes.
but I don't need a doctor every month, I need a doctor to just go and see the beneficiary twice a year. Would that
Yes.
still be $30 a month?
No. It will $30
Okay.
so that will be $60 then for the year.
Oh, okay. Okay, so it's per visit, basically.
Correct. Yes, per
I
visit.
see. All right.
Okay. Whatever the number. So if it's twice a month, it's $60 for that month. If it's twice a year, it's $60 for the year. So it's
okay. Okay, thank you.
I think Ben wanted to ask a question.
Yeah, Tobi, thank you. My question is around continuity of care. So you mentioned that the doctors have like their own side of the portal, but I just wanted to know if you can get the same doctor visiting you can choose that option for continuity of care.
There's no need to choose. That's what happens. So you are assigned a doctor, and
Right.
that's the person that gets to see your beneficiary throughout time. Now, if they move, then they get assigned to another doctor in the area where they move to, if that doctor cannot get there. Okay.
Yeah.
Or if the doctor moves, they just assign someone else. But the default is that it's one doctor for the beneficiary.
Perfect. Thank you.
I think one person had a question. Sorry, I'll just go through. Okay. Let me just show the website.
Yes, I do have a question. Sorry, my hands
sorry.
were up. Sorry.
Yeah, sorry. Yeah.
Yeah, my brother, God bless you.
Go on.
I did come in a bit late, so I was trying to digest what other people's questions, so I can help me. I don't need to repeat myself or make you repeating yourself. So far, I think I've been able to get some information and to be able to start from here. So I'm going to be touching a few things that I've known, because obviously I've heard. One is you mentioned about $30 monthly. So that $30 is you're referring to whether or not there is service on that month.
No, that's not what I was referring to. So I think the majority of times I think the market is usually as a monthly visit. So, monthly visits for the year, right? Which is what is $30. But if you choose less, it's $30 for the visit. So if you're choosing 2 visits in a year, it will be $60 for the year. If you're choosing,
so what you saying, the practitioner recommend one a month at least.
That's what Gerocare as a service, that's what they're recommending. And the reason for this, now I understand that most people might not need monthly visits. I guess the idea from talking to the management, the idea was that from a prevention point of view or early detection point of view, you get to know things much earlier than when it's too far gone. Okay,
Good.
that's one.
That's a good idea, actually. That's a very good idea.
That's one. The other thing is that it's a form of again, depending on the elderly person and where they are, it's a form of social interaction that they might not get otherwise. And it's just a means of I guess regular reminding that you're thinking about them, sort of thing. Now the CEO was telling me that when he was on the road in Port Harcourt, what happened was that after some time, the families that he was looking after, that visit was the highlight of their month. They're expecting the doctor to come and see them. The feeling that someone is checking their blood pressure, doing all those, spending that time with them is enough to make them feel alive, kind of thing. So
good.
So that's the idea behind that. But from a strictly medical point of view, I understand that it might not be necessary to have that frequent visits.
Or even more than necessary. You never can tell, depends on the condition, like you said.
It can be twice a month as well, depending on what is required. Yes.
Thank you. Another one is this is a GP service, right? Or is there a what is it? What do you call it?
Specialist.
Specialist.
Yes. So this is primary care.
Yep.
But if one of the recommendations is a specialist, Gerocare can organize that as well. So we've had to do that a number of times for my parents. So it might be that after the evaluation and the blood tests, the doctor thinks that they need to see a kidney specialist or a heart specialist or whatever. Gerocare organizes for that, and that person also comes to see them at home. Okay. Now that fee is obviously different. So because that's on a need basis, what they do is that they will raise the invoice for that visit, and the specialist will come and see them at home. Now, if it's not possible for the specialist to come and see them at home, they will let you know and then provide logistics for whatever is required. But the default is home visits.
So do you do what do you call it? Gerocare? Is that the word? Gerocare. Are they able to release health informations like reports if the patient want that report for that, maybe as they
so you get as a sponsor, you get the reports on the platform.
Okay.
The report gets sent on the platform, so you have access to the reports.
So if a patient have been with you for 2-3 years, they can have a 3 years of report.
It's not. It's on the platform. You log into the plan, you can see it yourself.
Okay, you can follow. Okay.
Yeah, you receive it, so you receive it and you can see it yourself. So
beautiful.
You can download and whatever. So it's you have access to it.
Thank you.
Okay. Some questions on the chats by Victoria. I'll start from the last one. So how many years experience do doctors have? So interesting question, which I did ask the management team. So because of the costs or the cost that as a sponsor we are paying, most doctors are within the range of 3 to 5 years post graduation. So most of the primary care doctors, so definitely post NYSC, between 3 to 5 years after NYSC. Now, if you think about if you were at home, if you were in Nigeria and you went to a private hospital, as the first point of contact, these are the kind of doctors you see anyway, even in public hospital. those are the kind of patient doctors that you see, that in mid-range sort of experience. And then what happens is that a consultant reviews the report or the case as required. So again, with Gerocare, they have family care specialists, so someone like me, like a GP specialist, that regularly reviews the doctor's reports and give feedback as required. Okay, so there's an oversight there for the doctors, even though they may or may not be specialists. Obviously, if they require specialists, that's different. Those are definitely specialists. And so we've had to use a geriatrician, for example. We've had a cardiologist. Whatever specialists required can be organized. Now, which hospitals does Gerocare use? So, um, we've not had to use any hospital service for my parents in the time that we've been with Gerocare, but they have partner hospitals across the country. I can't tell you what the list exactly is, what the names are, but my understanding is that they have those partnerships that, if it's required, then they can take the beneficiary to the hospital. Or if you already have a hospital that you use, they can also take the beneficiary there if required. For the ambulance service on the platform, you can actually request an ambulance service. We've not had to do that, so I don't have an experience or knowledge of that, but it's possible to do that from the platform. I'll show that to you as well. So let me just go ahead to show you what the website looks like. I'll share my screen again. Let me know if you can see that. Can you guys see the website?
Yes.
Okay. All right, so that's how it looks like. It's gerocare.org. And you can go through all of the options there to read more about it. But I just want to show some important, some parts that I think that are quite important. So if I scroll all the way down to the end, so sponsor processes. So basically a summary of what I've described. I'll open that in a different. Can you see that still?
Yes.
Okay. So yeah, so this sort of goes through the process for the sponsor, and just a run through of what I've described all the way down there. Okay, you can have a read of that as well. The other important bit I wanted to show is coverage. This is a very common question of what the coverage area is. So if I click on that, so you can go through any states in Nigeria and see what the coverage is. So any random states? Can anyone say any random state? Let's start with, say, Benue State. So you can see the location there. It sort of divides into normal rate and added cost. So the location there has normal rates. It means that if your beneficiary was there, the cost that I've described applies. If they were outside of those areas and they were in one of those places that says added cost, it means that there's additional cost simply for the logistics of getting there in terms of the service. So, but in practical terms, wherever they might be in the states, it can be covered. So Jericho will be able to walk around how to do it. Okay, if they are outside of the normal rates area. Any other random states, say, I don't want to do Lagos because that's fairly obvious. Say Osun State. So again, you can see all the locations that are covered that are normal rates, and the others that are added cost. So again, it just means that wherever they may be, it is possible for Gerocare to provide the service. It may just require a bit more time, maybe, or an added cost in terms of logistics. So, you can look at any of the state that you're interested in, wherever your beneficiary might be, and have an idea of, what the coverage is. So, let me put a caveat here. This list here, as you can imagine, will be dynamic in the sense that the Gerocare can only tell based on their list of doctors where they are and where they can service. But obviously people move every time. So sometimes this might not be up to date. Okay. So for example, if a doctor has moved away from an area or moved to an area, it may change whether the place is still a normal rate or added cost. But regardless, when you engage Gerocare services, they'll be able to, tell you where your area falls under, if it's different to the normal rates. Now the other thing I wanted to
You
show.
quickly pick Ogun State.
Oh yes.
Can you
Okay.
quickly pick Ogun State?
All right. So that's Ogun State. Which location did you want to? Have you seen anything that? So everything
I've
seems
seen
to be normal,
Abeokuta
right?
North.
Oh yes. So
Abeokuta North and
Abeokuta.
South is good. It's okay.
Oh yeah. Yeah. So most of Ogun State is normal rate. Okay. Now the other thing I wanted to show you was, oh yes. Going back to the main page. Okay. I'll just scroll up again, back up. So FAQs, frequently asked questions. So if you have any questions that you can't think of now, this area covers the majority of the questions that people ask. I'll just touch on two more things that is not really explicit on this list. So one of them is payment. Like I said, that cost of the doctor subscription is US dollars. I know we're in Australia, but as you can imagine, the naira is very volatile, and I guess from a business point of view, it's better for them to have their fees in US dollars. This only applies to diasporans. So if you're checking the website from outside of Nigeria, my understanding is that the system will show you the fee in US dollars. If it was within Nigeria, obviously they pay in naira, but outside of Nigeria, you pay in US dollars. Now, for us here in Australia or wherever else, whatever card you're using to pay, as long as it's an international card, it will just convert it to what your local currency is. Okay, whatever that might be at the time. But ultimately, Gerocare will receive the amount in US dollars. Oppa, you had a question?
My question is has to do with normal rates. So I'm saying that I saw something about normal rates. So is it that if it's somewhere like Lagos or Abuja, the rates are higher, or
No.
what
Oh
does that
no.
mean?
No. I just didn't show that because those are very city locations. I'll go back to that and show you.
No, I just want to know what the normal rates meant.
So normal rate just means what the rates I've just showed you, the $30 per
The
visit.
$30, okay.
Whatever.
So what is an abnormal rate? What is not a normal rate?
Added costs. So the other locations are listed as added costs. Simply because of logistics of getting there.
I see. Okay.
If there's no doctor that is covering that area, or if they have to go quite a distance.
Quite a distance.
Yes, so that will be included in the cost. But Gerocare will be able to tell you what the cost will be.
I see. Okay, thank you.
By the time you, so that's the difference between normal rate and added cost. The other thing I wanted to talk about was security. So proof of ID and security for the people coming to the house. So essentially I'm saying that you have doctors, you have nurses, you have all the healthcare professionals coming to the house, how do you know that this person is who they say they are, and how do you ensure the security of your elderly one? So that was a challenge for us at the beginning. Those were the questions we asked. And in discussion with the management team, over the 7 years that they've been in operation, there has not been any major issues regarding that. And I can speak from the doctor side of things, because before a doctor is onboarded, you can always verify what their identity is. There's a public register with the Medical and Dental Council, so you know for sure that the person onboarding this or the service as a doctor is a doctor. And you would expect that most times doctors are held into a higher I guess service standards. So them come to the house and providing service, I don't see that there might be any issue from a security point of view from a doctor. In terms of the other people, say for example, someone is coming to the house to pick them up for a blood test or whatever. So the lab has engaged, or they have their workers to do that. And what happens is that there's a standard operating protocol that Gerocare uses, in which case when the appointment has been scheduled, they send you the sponsor, the details of the person coming, their phone number, when they're coming, and they would have contacted the beneficiary as well, that this person is coming at this time. They're picking you to go to this particular lab or whatever, and then they're bringing you back. So you have an idea of who is coming and when they're coming and where they're coming from. And we've used that obviously, multiple times for my parents over the last couple of months, and there's not been any issues in that regard at all. And from the nursing point of view as well, so in that case, someone is actually living in the house. So we're using living in carers. It's actually not one person. So what the system that we have adopted is that they actually rotate in 2 weeks. So one person comes, spends 2 weeks, and then somebody else comes, spends 2 weeks, and then the first person comes, and then they exchange interchange like that every 2 weeks. Sometimes we've had to change the carer for multiple reasons, personal reasons, or change of job or whatever. So over the last 1 year, there have been multiple people that have come to the house as carers, and again, we've not had any issue with security or stealing or anything like that. So the identity of those people are they get sent to us, the identity, their experience and all that before they come on board. They don't just send them to the house and leave them alone. There's regular checks both on the beneficiary side and on the carer side as well. So I think, as far as I remember, they have regular meetings on Monday evenings for the carer. So Gerocare, the Gerocare nursing partner service checks in with the carer to see, how are they faring, any issues, any inputs into what their care is. They also call my parents, I think twice a week or so on the average, to see, how are they going? Is there any issues? So things like that sorted out before they escalate, to anything big. And like I said, we've had to troubleshoot through a couple of small issues, but nothing that was unsurmountable. And I think as a family, we're happy with how Jericho has handled, whatever issues that might have come up in that time. So now, when I ask my parents about what their services is, they don't have any complaints really. They've gotten used to the fact that someone comes to the house. They do a handover every couple of weeks, and then it goes back and forth like that. So I just thought I should mention more information about payments and security, because I don't think that's explicitly stated in the FAQ section, and it comes up quite often when I talk to people about it. Yeah, I'll just move on to the next now. I wanted to show on the website. So back up here, you can, when you're ready to engage the service, you just sign up. So yeah, you put your name, your email address, and all that. Now here, referral code. being the country director, I do have a referral code that I will encourage you to use. So it's on the presentation. It's 967400. And I'll tell you more about that in the next slide. So when you do that, you put a password and it takes you to the next screen. You add your beneficiary, and then you choose a plan. So that's basically everything that happens. And then the client services will contact you if you haven't chosen any subscription frequency yet. Now, I have, okay, so this is the dashboard. I don't know if you can see that.
Yes, we can.
Yeah, okay. So I just created a demo account just to show you what the dashboard looks like. So on here, you will be able to see on the left panel, you can see a couple of options of what you can go through there. I added some beneficiaries here just to give you an example. So if I click on added beneficiaries, I just put this random identities there, but this is where you would see your beneficiaries that you've added. And when you click on view elderly, so I'll just click on that so you can see what comes up. It's a bit slow, the internet. Okay, so on here you can see I'll just go on the left panel first of all. You can see the elderly's profile, their phone number, and all that. Okay, here you can see the assigned doctor. So there will be a name of the doctor that's been assigned to the elderly on there. And there's usually the phone number there as well. Going back up there, you'll see all the tabs for the visits. If there's any reports to come up here. The caregiver also give reports if you have a caregiver. You can see the number of subscriptions you have, what is left of the subscriptions. Then test results comes up here. So that gets uploaded on the platform. That's where you see it. And then what happens is that after the tests are done, the doctor also makes a side note on the results without having to go back and visit. So that means they also have access to the platform for their own patients, and they can make a note because there might be recommendations based on the test results of what the next steps are. If there's specialist reviews, they get uploaded here as well. And if for whatever reason these reports are not there, you can always reach out to the medical services team and they can send the reports to you as well. So all of that you can get through this part of the portal. Going back down to this side, subscriptions, you can here, that is where you choose what subscriptions you want for your elderly. If it was just one person, so I've clicked on that on Mr. Australia. Going down here, I can choose if it's just a visit for that person. So if it's one person, but because I've put in two people at the same address, there's an option for couples home visits. There's phone or video consultation as well. The HMO one is more of a block package. If you go back to the website, you'll be able to see what HMO packages they are. So standard or gold or whatever. So what that means is that there's a collection of things in each package, which will be number of visits, the allowance for tests, allowance for medications for the year. I don't really do that because it means that you're locked into whatever package you choose, and then anything outside of that package you have to pay more. So I just do ad hoc as required. So so if we choose couples on visits, here you can choose the frequency, sorry, the number of visits that you want. So if you wanted to say 3 visits, and you choose every 3 months. So what that means is that this will be one visit per month for 3 months. and since it's for couples, that's $180. Okay, and then you just go here, click on whatever payment mechanism you want to use, and then pay for it. So if you wanted to do, say, I don't know, say one visit every 3 months, that's for the couple. That's why $60 for two people. So that's what you choose, you pay for it, and that's it. So when it's the end of the 3 months, you'll be able to see back on the beneficiary list that you have expired subscription, and you can pay for more if you want. And yeah, so you can just go through that and see number of visits or the frequency that you want for either one person or as a couple. It's a bit difficult or tricky to choose for one person if you have two people living in the same house. So I'll give an example. So my dad he has some medical issues, but is fairly well up and about, but my mom isn't. From a practical point of view, there's while he doesn't need to be seen every month, my mom needs to be seen more frequently, and it's sort of difficult to just pay for her and not pay for him because they're in the same house. So if they come to the house, it wouldn't sort of, from my point of view at least, I don't think it would look well to just for the doctor to see one person and not see the other. So you might have to pay for the couple, but it just depends on your family dynamics and how that works out. But you have the option of choosing for one person or for a couple, depending on what the needs are. So that's for subscriptions. And down here you can see the appointment book, what is upcoming and what has been done. What happens is that the doctor can pre-schedule the next appointment if there's still visits that have not been used, or that's always in consultation with the beneficiary to see when the availability is. And if there's a change, to just communicate between each other that I can't come again today, or I'm not available anymore, and then they reschedule. You as a sponsor, you get all that notification as emails and stuff, so you know what's happening. And yeah, so the rest of the points there is you can see your prescriptions there as well. And this is where you can request the for ambulance. So like I said, I don't have any experience about this, but from what I can see here, you can request for ambulance in, this will be major towns though, major cities. So you have the option of filling in the details there and where the location is for where the ambulance is required. I would say that if I were to do this, I would probably just contact the medical services directly and then be guided by them. Or yeah, since I have access to them and you have access as well as a sponsor, you can just reach the medical services team and they can guide you as to what to do if required. And down here you can, there's an opportunity to give feedback or complaints or whatever the case might be. And like I said, besides this mechanism, Gerocare Client Services also calls the beneficiary to find out, um, what's been happening, what their concerns might be, if there's any. So for the doctor visits, actually, they do call them afterwards just to get an idea of how the visit went. So, there's always checks and balances as they go on. And the last thing that I want to show is the caregiver application. So if you wanted to use the caregiver service, there's an assessment process that happens before someone comes in, does the in-home assessment, and then tells you what the recommendation is in terms of the kind of home care services that are required. So that's basically how the platform is and how it works. Does anyone have any question about that? I'll go to the chat. I think there might be some. Okay. Does Gerocare have a physical location? So they have offices in Lagos, Port Harcourt, and Abuja. So those are the physical location. But again, the way the services is rendered, well, I can't think of any reason why you would need their physical location, because that's not where the care services gets done. The range of cost for living care. So that's different for the kind of services that are required. So I can give you an example from my experience. So when we did the assessment, they came back to suggest that a registered nurse is what was required. And at the time, we were quoted 300,000 naira per month. Okay. Now, I think there's an advantage there. Me being a doctor, I was able to look at what is covered under a registered nurse and what is covered under a non-medical caregiver, so to speak, or an auxiliary nurse, so to speak. So, and I knew what my mom required. So I was able to say, well, I don't think that she needs a registered nurse. I think she just needs an auxiliary nurse, or assistant in nursing. They were able to they agree with that, with the caveat that if the needs supersedes what the person can offer, then we'll have to go back to the original plan, which we agreed to as a family. So the cost for us now, as for the living assistant nurse, is 150,000 naira. Now, I don't know what it will be now or in the future. I don't know whether that will be quoted in naira or not. But again, that will be up to Gerocare to decide and determine. Okay. Can I access the services from first visit and decide if future will be? Oh yeah, you can. So you can pay for one first of all, and then I guess in negotiation with the doctor, you can then determine whether this is what you want to do monthly or less frequently or not. But don't also forget that the doctor being doing the assessment or doing the review will be able to have, we'll be able to give an educated guess as well as to how frequent they think, from their professional advice at least, how frequent they think that your parents or your beneficiary should be seen. And like I said before, it's not just about the medical care. There's also the social and psychological part of that visit. And one of the things that the CEO shared with me was, if you did it for 3 months, for example, and then you made it less frequently, the chances that your parents or your beneficiary will be wondering what happened, in the sense that, if they've enjoyed the service, they would be grateful if it was more frequent. And again, that just speaks to the social and psychological benefits of that encounter. They're just something that it does. Someone listen to your heartbeat or do your blood pressure and things like that. It just does something to their health perspective, and that can be quite valuable. Can Gerocare direct for vision and dental? So so we just had our last doctor visit for my parents. I think it was 2 weeks ago, and she needs to see an ophthalmologist. So the answer to that is yes. So if that is required, they can organize for that. Dental, I would say yes. I don't have any experiential knowledge of that, but I would say yes. Obviously, in that sense, the dentist cannot come home because the equipment will not be usable at home. But Gerocare will be able to organize for the logistics of pick up and drop off for a dental care. Okay. All right. Thank you, Victoria. I'll just see what else I had on there. Okay. I'll go back to my presentation. I just have one more page, so I've gone about 10 minutes beyond the time I had. Okay. So on a final note, like I said, I'm not part of the management. I'm a sponsor, like everybody else. And the reason why I'm accepted to do this for them is, as a doctor, as a GP, I see this as like an extension of my service to, those back at home without physically being there. And yeah, that's basically why I've agreed to do this for them. Now, going back to the referral code issue, there's a percentage to me for every doctor subscription. So that only applies to the doctor subscription fees. Any other costs, tests or drugs or nurse services, I don't get anything, but I do get a percentage as a Gerocare booker in Australia for the doctor um, subscription. So I just wanted to mention that as a potential conflict of interest, but the amount is quite negligible, really. That will not be enough to make me do this because I think it's 12% for me, for 12% of $30 really. It's really not enough as a motivation, but I just thought I should mention that as a potential conflict of interest if anyone was interested. Now there's an opportunity to be a Gerocare broker as well. So I can sign you up as a broker under myself. So the system generates a referral code that you can use. So if you were interested, just let me know. So what happens is that broker code will be different to mine, and whoever you engage and get on the service that uses your broker code, you get 10% of the doctor subscription. So since I've been the country director, that I think is August, I've been linking up to Nigerian groups across the country, both the state-based groups and ethnic groups. There are lots of them, but I don't have any contact yet with groups in the Northern Territory and ACT. So if anyone has contact to those groups, please let me know. I would like to have that. I know there's a big Igbo community in Alice Springs. But so if anyone has any links to any of these Nigerian groups, please let me know so I can get in touch. Now the management team has also agreed to a month trial for a nominee by this group's executive team. So if you're in any of the Nigerian groups and you're an exec, you can nominate yourself or someone that you know to just try the service for a month for their beneficiary at home, just to have a first-hand experience of how it works, so that you can have that experience as well, so to share with the rest of the executive team and the rest of your members. And they've also offered a 10% discount to members of those groups. So how that will work is that if the group if the executive team agrees for that to happen, they will contact me and I would register them as a broker. But what happens is that it will be a commission basis. So which means that, sorry, to be a discount basis. So the code will be generated for the association, for the group, and anyone in that group that uses that code will get a 10% discount for the doctor subscription. Okay, so that's just another opportunity for the association to offer something to the group that they think might be beneficial to them as a whole. So those are just the final things that I had. And if anyone has any more questions, you can ask. I think there's one on the chat box. No. You don't have to be a doctor to be a broker. You just have to be able to. You just have to be able to talk on market. That's all. You don't have to be a doctor. Okay. So that's all I had. Does anyone else have any questions? Or have I answered everything? Okay. So in the absence of any questions, we'll just round up now. Thank you very much for your time, for joining. I hope this has been helpful. This is recorded. So I would have the link afterwards and share it with you guys, and I'll share it on the groups I've joined as well. So it can be accessed anytime. Okay. All right. Thank you very much, and have a good night.
Thank you.
Thank you. You're welcome.
Thank you. Thanks, Dr. Tobi. That was excellent. Thank you.
Very well. You're welcome.